I had Lasik in 2007. It's been going on 8 years ago, and I was farsighted, nearsighted, had astigmatism. My eyes were pretty bad, and this is 2007, so I laid down about 4 grand, exactly 4 grand, um, to get LASIK surgery on both my eyes. And at the time, I had to borrow it. I didn't have cash to pay for it, which monetarily, that's a stupid decision. But it's been 8 years, and I don't regret it one day getting it done. As a matter of fact, I tell people it's probably the best money I ever borrowed getting LASIK eye surgery done. And it's a quick procedure. Usually takes like a second. Well, that's exaggeration. A few minutes for them to do it. And of course, you have to do all these tests. Not as bad as you think it is, but you do have to have tests where they examine your eye, test it, all that good stuff before, to realize if you're a good candidate or not. And now, technology's changed a lot in that 8 years. There's actually a little bit more, they're a little bit even more sophisticated than they were in 2007. And they didn't used to always use lasers for eye surgery. They actually used to use physical blades to do eye surgery to make your eyes 20/20. But I always had the question, you know, if you can see perfectly, why do all these eye doctors today, optometrists, still wear eyeglasses? And I never could figure that out. And I actually asked my last eye doctor, who actually was the one that referred me to the LASIK eye surgeon, so she can get commission or whatever. And for you guys that wonder why eye doctors refer you to LASIK surgery, because they're going to lose business right throughout the years of not treating your eyes. The reason they do it is they get a pretty nice hefty commission, and so they make more money off the commission off of LASIK eye surgery than the service that they would get over a decade, let's say. And you might move away from the area, what have you. So that's the reason they do it. And she wore glasses. I asked her, I says, why don't you have it done? She says, oh, I wasn't a good candidate to get it done. My eyelids, something, my pupils were too thin or whatever. I was like, oh, okay. And I was like, okay, whatever. And before I had my LASIK eye surgery done, I did a lot of research online about it, and I heard a lot of horror stories at forums. Where people, this one poor lady, she had it done, and she wasn't completely healed, and I think her daughter at the beach like accidentally hit her eye and actually knocked the flap, because what they do, especially 10, 20 years ago, they would cut a little bit, and there would be like a flap that would have to heal on your eye, on your pupil. And her daughter accidentally hit her in the eye, and it completely damaged it, and she couldn't see 20/20 anymore, and completely messed her up for life. And I've heard countless of stories on forums where people had it done and the pain would never go away. And there have been a few people who'd commit suicide from it because they had it done. The only reason I had it done is I was going through a midlife crisis at the time, and it was sort of like a thing on the whim that I did it. But it was a good thing. I'm glad I'm glad I ended up doing it, because especially in the South, where it's humid and it's always hot, And, you start, after you get it done, you start realizing little small things. When you're driving, you have glasses and you turn to your blind spot, like if you're making a right turn and you're looking at your blind spot, well, the frame of your glasses get in the way when you're like turning. Or when you wake up in the morning and the only thing you can see is, you know, blurriness before you put your glasses on, you know, or when your glasses just start steaming up, because of humidity. I mean, it sucks. And then contacts are no better. They're actually worse. You put these little hard pieces of plastic in your eye and you have to take it out and then wash them and put them back in. And it's very monotonous, right? So, and I've had great success with mine. Again, I've had mine now for going on 8 years, and I love it. I love it. And, I haven't hit that point yet where I'll need reading glasses, which everybody does eventually. But I was reading up where new technology is going to come along where we'll actually have a fix for that too, for reading. But a few years ago, I was, managing a hotel, and an eye doctor came in, to check in. Sure enough, he had glasses. And I asked him, I says, "You guys know that there's LASIK surgery out there. Why don't you get it done?" And he looked at me and he says, "Well, have you ever bungee jumped before?" I said, "No." He says, "I haven't either." And usually when you go bungee jumping, everything's okay. But there's that one possibility when you go bungee jumping, and it's not like a 0% possibility. It's pretty, it's definitely a good possibility, maybe 1 or 2%, where your rope will snap. You'll head first into the water and you could die, or get another serious injury, the spine injury or what have you. He says it's a possibility. He says the same thing with LASIK eye surgery. He says, yeah, most of them are a success, but we know as eye doctors there is a possibility that it could go wrong. The surgery can go wrong, and we'll have damaged eyes the rest of our lives. And a lot of us are not willing to take that risk for 1 or 2 or 5%, whatever it is, chance of ruining one of the major senses that you have to go bad for the rest of your life. They're not willing to take that risk because they've probably seen people who've lost their vision or who've had blind or pain or whatever getting that surgery done. If anybody's seen it, they've seen it, right? So that is the reason that you see so many eye doctors with glasses on and they don't get LASIK surgery, and that's the reason. All right. Thanks for watching.